Yeah, hey everybody. Thanks so much for showing up. So I'm going to talk a little bit about what the tool was and how folks could have their voice heard through it, and then we'll go a little bit into the numbers. If you'll allow me, I'm going to go ahead and share my screen here. Let's see. Okay, well, you all can see this. All right, so what the tool was a means for anybody to come via the internet to access a program that allowed you to add or subtract from each and every city department funded by the general fund. And so the general fund for the city is the discretionary funds that our city leaders really have a lot more ability to and sway over budget cycle to budget cycle. And so that fund is up to now over $1 billion annually. And so what we wanted to really see is how folks in the broader community would allocate money to the existing departments that are funded through the general fund if we had our say, if we could pick it from the get. What we also did was we talked with folks who are proposing alternatives, particularly alternatives that relate to public safety and public health, that were really coming to the city this year with some proposals around those initiatives, because we wanted to see if there was support for some of those initiatives. So if you look here on the screen, for instance, you can see there's a question about mental health first responders, which we know there's a push by AJC and other groups to continue to fund and to expand here in the city. So you could come into each department, you could add, you could subtract, and then for certain city departments, you could choose to put specific funds towards a project that we know is available. So what we're going to do now is talk about what the results were, and I'm very excited to be sharing the results with you all in terms of what people actually said on average when they filled this out. So overall, what we ended up having was a lot of people filled this out, but when we looked particularly at just those unique submissions, so some people went in and submitted more than once, so we pulled those out, looked just for some unique submissions, and then we also did is we pulled out everyone who wasn't from Austin. So this tool ended up getting some national participation. We had folks from New York and Denver and Philly and of course all the major cities around Texas filling this out. But we didn't want to include those in the results that we push out to council to show kind of what support looks like in our community for these different things. So we had at the end of the cutoff period, and we still have folks submitting responses, and you're free to continue to do that. But at the end of the cutoff period, we had about 1,500 local unique responses to the tool. And so what we found was that support for divesting from the Austin police budget was 95.8% of respondents. So 95.8% of folks said that they supported cutting money from the police department. And we did that by just looking at who ultimately took money away based on last year's budget from the police department as part of this exercise. So 95.8% of folks reduced the police department budget. We then looked at, okay, well, what was the average desired cut to the APD budget? And that was over $236 million. So that ended up being a little over 54% of their budget from last year. So we've seen different groups that call for 100 million, 200 million, 22%, 50% of the budget. And at the end of the day, the people that filled out this tool went beyond all of that and have called for a 54.48% of the budget cut. And we're going to talk a little bit about, well, where did they put the money? Where did they actually say that money should go, and what alternatives did it go into? And we've got some great folks here to talk about some of those proposals. Other interesting findings. We had a specific question about support for decreasing the overall number of police officers. And the And the affirmative answer to that question was over 91% of folks said that they supported not just cutting the funding to the police department, but actually cutting the number of police that there are. And the last thing I'll leave you with as far as this data goes is the refund submissions by zip code. And so what this really kind of gets across to you is that, you know, these results weren't really centered in a single part of town or a single part of Austin. They were across the board. So you can see that we had submissions from every zip code in the area, in the region. And we had, you know, fairly good representation across them. Now, obviously, there are a couple of zip codes that had more submissions. So what we really hope is that the council will listen to this, right? Emily's going to talk a little bit more about where we sit today and the preliminary budget that the city manager put out, but what's clear is that we have a long way to go to reach any of the goals that we've set as far as really making significant cuts to the police department. But again, we're not just talking about doing that for its own sake. As some of these folks are going to come up next are going to talk about, is that there are specific things that we think can address public safety and public health that where this money hopefully would go. And honestly, that needs money regardless of what happens. So with that, I will now turn it over to Suki McMahon to introduce some of our speakers who are going to talk to us about some of the alternative ideas for investments of the city budget.
Thanks, Chris. So you all saw in the survey, and if you took the survey, there were the options for these alternative investments. And I think folks are demonstrating that they're really starting to think about what police should and shouldn't be doing and how to narrow the scope of policing, and starting to invest in other versions of public safety. So we're going to start out with harm reduction. That was an option that was on there. And we have a couple of folks from the Texas Harm Reduction, Kate Graziani and Joy Rucker, who can tell us a little bit about that proposal and what that safety, that form of public safety looks like.
Great. Thanks for having us. My name's Joy Rucker. I'm the executive director of the Texas Harm Reduction Alliance. And so I just want to give you a definition of harm reduction. It's an evidence-based model that aims to reduce the drug-related harm experienced by individuals and communities. Harm reduction is also a social justice movement built on the belief that in the dignity and rights of the people who use drugs. And part of that social justice element is looking at systematic systems that have been creating harm to the folks that can access services. So why harm reduction? It decreases overdoses. It decreases HIV and hepatitis C infections. There's fewer interactions with the criminal legal system, fewer ER visits, more people are housed and stay housed, more people connect to treatment, and more people find a path to recovery. So we were formed in 2019 as a mobile outreach with a Texas overdose funding from the state, the federals, and it went through the state. So currently we provide a mobile outreach team that connects people living in encampments. We provide them with supplies and connect people to treatment and recovery coaching. So part of the supplies that we and provide to people are clean syringes, harm reduction supplies, anything to keep people safe. even though syringes are not legal here, we're not asking for funding for that. We're asking for funding for everything else. We provide 5 weeks of medicated assisted treatment for our priority population who are experiencing homeless, pregnant, and recently overdosed and recently released from jail or who have HIV. At our drop-in center prior to COVID-19, we offer bathrooms, snacks, access to a recovery coach, and a place to really just chill and come and connect. And then we also do local and state policy coordination. So really for us, there is no other harm reduction drop-in center program like this in Austin or in Texas. And we really need to reach these people that are injecting drugs. And that's what we're trying to do. And Kate will talk about the rest of what we do. Kate?
Thanks, Joy. Kate Graziani with the Texas Harm Reduction Alliance. Also, I'm just going to speak briefly about what we're proposing to City Council this budget cycle. Harm reduction specifically as an alternative to police is important for us to think about in Austin now that we exist. We know that there are thousands of unnecessary drug-related arrests that happen in our community. We also know that our police force is not willing to carry naloxone, our overdose reversal drug. And so I think harm reduction can actually help us make a culture shift when it comes to drug use and a public health approach instead of a criminal legal approach. And so what we're asking for this budget cycle is to expand the comprehensive harm reduction services available, which means expanding hours at our drop-in center, expanding our mobile outreach clinics. Right now we have a mobile outreach team, but we don't have a mobile outreach clinic, and we'd like to be able to reach people where they are. That's part of low barrier services. We want on-demand access to methadone. There's a 6 to 9 month waiting list for Integral Care's methadone clinic right now, and we think that's unacceptable. We also want to link people who are leaving incarceration to recovery coaching, treatment, and housing. I know Matt is going to speak more about housing, but we also would like to see housing first and harm reduction programs expanded here in Austin. And we want to see a pre-arrest deflection program for drug-related charges in collaboration with the Sobering Center. And we're able to do all of that for just over $1 million. So think what we could do with 10. All right, thank y'all.
Thank you, Joy, and thank you, Kate, so much for that overview of all of the good that your work could bring. And I agree with you. You're doing a lot for a little, and the 10 million increase would be just groundbreaking for you all. I did want to point out that, as you can see, more than 36 million would be allocated in this budget from the People's Minds towards public safety, and 79.66% chose that $10 million increase to harm reduction specifically. We're going to move on to housing. We have Matt and Malika here from ECHO, who is going to talk to us about that alternative investment.
Welcome to the Alexa. Thank you very much, and thanks for having me. We clearly have the wrong folks putting our budget together. I think really like these results. You're going to hear a lot about the intersections of a lot of the different people talking here. Talk about survivors of domestic violence. We're going to talk about harm reduction and EMS and mental health first responders, and how all those things come together to create a more just and equitable system for the people experiencing homelessness on the streets right now. As many of you know, we've had massive disinvestments in housing and homelessness over the last couple decades, certainly on the federal level, and on all levels of government through the state and local level. Right now, we're still seeing huge cuts on the federal level to HUD, and to other safety net programs that help people experiencing homelessness in our community. Really, I think what that means is that our local governments have to step up in the interim while we continue advocacy efforts on the state level and on the federal level. So what we're looking at right now is we're asking the city for a $38 million increase in to go towards homelessness, to go towards permanent housing options for people experiencing homelessness in our community, low barrier permanent housing options. We have a really high rate of people experiencing chronic homelessness in our community here in Austin. About 48% of the people that are in our homeless response system are considered chronically homeless. And what that means is that they have a long-term severe and persistent disabling condition they identify, and they've been homeless for an extended period of time, which means that our system right now, the programs that fund our system, are difficult to access for people and that the right services aren't provided. So we're looking at massive investments in permanent supportive housing, which is housing that has rental assistance and supportive services attached to it that include harm reduction services and housing first services. So that means that folks can come in to the housing programs regardless of any criminal history, any history with substances, obviously any mental health or healthcare history that they might have. And there's a massive need for that. And we're asking for 300 units of permanent supportive housing to get funded in this year's budget. We're asking for about 250 units of rapid rehousing to be funded in this budget cycle. Rapid rehousing is a similar intervention, just a shorter term intervention for folks who don't need the permanent housing options that the permanent supportive housing provides. We're also looking for about $800,000 or $800,000 in diversion services. So that's to help folks that just need one-time assistance to get out of the homeless response system or to prevent them from coming into homelessness. So we have massive gaps across the board in our response to homelessness here in Austin. We had the most accurate count to date of our point in time count numbers recently that showed close to 1,500 unsheltered people sleeping on the street in one night in January. We know that that's not close to the number of people experiencing homelessness on the streets. We know that represented in those in that population, 36% Black. We know that 8% of our Travis County population is Black. So we have this disproportionate number of people experiencing homelessness in our system who are Black. And we also know that many, if not the majority of those folks, have had recent interactions with our criminal justice system that continue to prevent them from accessing healthcare, quality, affordable healthcare and housing that they need. So we really need a reversal on how we look at public safety for people experiencing homelessness in our community. Right now, it's driven through, or has previously been driven through the policing and ticketing. So we got the ordinance changes. The ordinance changes came into effect last year that stopped the policing of people experiencing homelessness and the criminalization of homelessness. But now we need the investment in our permanent housing options and resources and outreach and harm reduction to take the next step in aiding people experiencing homelessness in our community. So I appreciate your time today and look forward to what we can do with the city budget.
Matt, thank you so very much for that breakdown of housing and what the possibilities are there. So you all see the numbers there. The average housing budget increase is more than 42 million. And we had this 79.39% choose a 38 million increase to housing. So that's substantial. And it's really promising that the community is really recognizing that need here. So next up, we had EMS and mental health first response on our budget. And we have Selena here. Selena, I have two hard to pronounce names. You have one hard to pronounce name. Would you please introduce yourself so I don't butcher it?
Sure, I'm Selena Shia. I'm president of the Austin EMS Association.
And let us know a little bit about the EMS proposal for the budget.
Yeah, so Obviously, with COVID-19, we're seeing that our level of call volume has gone up, as well as the time it takes for us to run every call. We're having to decontaminate after running COVID calls, and it really has reduced the number of ambulances that are available at any given time. We saw last week that at one point, every single Austin ambulance was on a call. We also saw at multiple points that every single North Austin ambulance was on a call, or every single South Austin ambulance was on a call. And in fact, we haven't added an ambulance in Austin in over 5 years. So with COVID, we are at the breaking point, and we are asking City Council to adequately fund EMS. When we're talking about conversations about policing, I do think that there's a lot of duplication of services. So there are quite a few calls that both agencies go on that we don't actually need police to be at. So we already talked about a few of these things, overdoses, for example. So once I went on a call with a young woman who took a hydrocodone because she had her wisdom teeth removed. And then she was so loopy, she forgot and took another one and called EMS because she was really concerned about taking 2. And then the police showed up. They do not need to show up for almost every single overdose call. And in fact, we're nervous that they're there to actually, once we use Narcan or once we make sure that they aren't experiencing a medical emergency, then going to potentially be arrested or have some other negative effects. Other examples of this are also, like Matt talked about, people experiencing homelessness. We don't need police officers, fire trucks, and EMS responding to these calls. And in fact, probably the most appropriate response is one of our community health paramedics that can, double check and make sure that that person has what they need, be it medications, be it food, whatever. We also go on quite a bit of welfare checks with police officers, and they're really making sure that these people are okay. EMS can do that. A community health paramedic can do that. And finally, what Kathy is really going to talk about is mental health calls. One issue that we're finding with that is that only police officers in the state of Texas can do an emergency detention. So we're actually working with Ann Kitchen on looking at legislation so that EMS can actually do emergency detentions and we don't need to involve police at all. Also, our association has taken really seriously the police brutality protest, and also this space to really rethink how EMS has historically and how public safety has historically done its job. You call 911 and you get the most expensive resource in the city. And sometimes a resource that can harm you. Even an ambulance, if we just take you to the hospital, but all you need is a sandwich, or all you have is an ingrown toenail, and we take you to the hospital, and then you have this like very, very expensive bill for an ambulance and a very, very expensive bill for a hospital stay, when probably all you needed was either a taxi voucher or to go to the urgent care or to go to your doctor. So we have also committed, what I would like to see is that for EMS, we actually know that 90% of our calls are not emergencies, in the sense that they're not having a heart attack, they're not having a stroke. And in fact, what is actually happening is that a lot of these calls are calls of poverty, people who literally don't have $5 to take a taxi to the ER, to the urgent clinic. And so I really want our medics to do a basic needs assessment on all of those patients so that community health paramedics know, have a better resource to see who in the community has needs that are not going to really interface with public safety, that we can really connect folks with the resources that they actually need. So those are a few things that we're working on. And I'll let Kathy talk about mental health.
Well, all that is really exciting, and having I know I've been watching EMS not get more money from the city budget process for years, and it always kind of hurts to watch that, because in most cases the community health paramedics can provide a range of really thoughtful approaches, and they're so good at their jobs. So we're excited to support that investment in community health paramedics and just generally EMS. On the mental health first response, I think this is one of the more popular and widely discussed ideas. And it's been in the air for a long time because Austin, unfortunately, has shot a lot of mentally ill people. And I don't say that lightly. I say that like it remains a kind of shocking truth that when people call in mental health crisis, they get sometimes they get a far too aggressive police response, and it has been very harmful. So we're after 2 or 3 years, 2 years of solid planning with the city and with integral care. I feel like we are finally having the conversation where we're asking really how much money does this take and how many mental health professionals need to be in the mix and where do they need to sit. And so they're talking about, Ann Kitchen has brought a proposal to the city manager that is partially worked into the city manager's budget, but there will be an additional ask for one more unit for EMS, one more CHP unit and supervisors, so that there will be both enough mental health support in the call center over at Integral Care, but also enough people on the front lines to make those connections and to be that alternative for a wellness check for those folks without needing to rely on police, unless the EMS people feel like they need to call police, which of course they can still do. So that's the vision, and it does require 1.1 million more than is currently worked into the budget that the city manager rolled out. So we're expecting that that's an easy thing to support.
I think that show that it is. There was an average $19 million increase to the EMS budget. 72, almost 73% of the respondents chose a $10 million increase into the mental health response. So, yay. And then our final area there is violence prevention and survivor support. And we have Amber Goodwin from the Gun Violence Task Force here to walk us through what violence prevention and survivor support looks like or could look like here in our city. Amber.
Great, thank you. And I want to just start off by saying the name of Mike Ramos and every single person in Austin and across Texas that has been lost to gun violence, whether that's through police violence, the people who are shot and survive across Austin. I think a lot of times when we talk about the issue of gun violence, it kind of seems like it's this thing that may happen somewhere else, but it's also an issue that's impacting so many people around the entire city. And so I just want to make sure that I start off by saying that. And also just to really thank you all for what you're doing, and especially the people who already spoke. You all are doing incredible work. And I think what someone said at the very beginning about harm reduction is just so true to the issue of gun violence as well. And I think a lot of the issues that were on the budget tool, that a lot of what we'll talk about is really intertwined. So I'm Amber Goodwin, and I'm on the Gun Violence Task Force for the City of Austin. I'm also really honored to be on it with Selena and 9 other people. And so I may ask Selena to just fill in for anything that I miss. But I wanted to just recognize that we were started last November as a response to a mass shooting. And I say that because for so long, not only in Austin, but across the country, we've either thought about, and by we, I don't mean everyone who's on here, but the media and politicians have really thought about either we're talking about what's happening in Chicago or we're talking about what's happening in Sandy Hook. So there's either we're talking about a mass shooting or we're talking about some sort of crime somewhere else, right? But most of us know that there's things that happen every single day whenever it comes to the issue of gun violence. And what we did as a task force since November is really thought about how can we provide the context for not only harm reduction, but also taking a public health evidence-based approach to reducing gun violence in all forms in Austin, and how can we make sure that we are treating the disease of gun violence like a disease instead of utilizing the criminal legal approach that has specifically been the main focus in Austin. When Selena and I started on the Gun Violence Prevention Task Force, I was like, why is almost half the room APD? We started off with a real focus on having to be literally physically in the same place as APD. We had to have all of our reports go through APD. And so we did our job as I think as a task force to make sure that we were really thinking about how do we support survivors and what does this look like in terms of gun violence. So I'm going to talk very briefly, very specifically about gun violence prevention, knowing that there are tons of ways and incredible people doing survivor specific support. What I'll talk about is from the auspices of somebody who, of survivors that we have talked with that were on the task force with us, but knowing that, again, this is one way out of a myriad of ways to work on the issue of gun violence. And just for context, about 100,000 people every single year about 100,000 people are shot, around that number. About 40,000 people every single year are killed by gun violence that we know, just numbers wise. We don't know the exact numbers in Austin. We're still trying to dig through the data, but in Texas, it's around 3,400 people. So 3,500 people a year are shot and killed. That is way too many people. And specifically in Austin, there has been challenges specifically with homicides, police involved shootings. And what we really wanted to do was to make sure that we weren't just trying to fix the issue of, stolen guns, gun crimes, mass shootings, or homicides just by putting a Band-Aid on it. We wanted to really focus on how we could provide and codify in law. So no matter who was mayor, no matter who was on city council, there'd be some sort of body who would really be able to tackle the issue of gun violence. And so we looked at what was happening. Our charge was to look at other cities across the country who had successfully, dramatically, I would say, reduced homicides, but also made sure that there was a center of gravity within the city, no matter who was elected, that was really focused on gun violence prevention. And so we came up with the idea, and again, people have been doing this all across the country, so we're not the first people who have thought of it, but to propose an Office of Violence Prevention. And so I'll just say quickly what the three kind of big buckets that we have come up with. Our report is not public yet, but I'm happy to share parts of it with folks and make sure that people get it. It took a long time, especially with COVID, to really make sure that we were getting together and also getting feedback from the community. But the action items that we propose to council is $25 million over the next 5 years. So $5 million per year for the next 5 years. And that $5 million would go to three buckets of work. One would be to actually create an Office of Violence Prevention as a centralized office, very similar to Philadelphia, to Oakland, to Chicago, to other similar sized cities across the country that have used the Office of Violence Prevention to help staff and centralize a lot of the different services, to work with other healthcare services, to work with EMS, to work with different other survivor supportive bodies within the city, but to have an actual office that has a budget that is autonomous from APD, and that had its own staff as well. And then the second part is that we wanted to help get contract with a group of or single person who could help with technical assistance that could start off by mapping out the city and really looking at and doing a deep dive on what is the cost of gun violence for Austin, where is gun violence actually happening. Right now, a lot of the data that we have is all through APD. We don't actually have gun violence statistics unless it has come from APD. So we'd like for somebody who's independent to come in and do an analysis of the city. And then third, we'd like to invest in evidence-based proven strategies, but strategies that work for Austin. Some of these strategies that have worked in other cities include things like Cure Violence, which is really taking that public health approach, but working with violence interrupters, working with people in the community to make sure that we are meeting the needs of survivors and victims of gun violence. And so that's a lot of really hard work, but it's also the work that needs to happen to make sure that people are actually safe and free from harm. Another part that I brought up actually to City Council was hospital-based intervention. So working with hospital systems to have them be the first line of defense instead of the APD. And there's a variety of other kind of evidence-based proven strategies to dramatically reduce gun violence. But again, they'd be all kind of working in this Office of Violence Prevention. And so I will stop there. And again, the number that we had put on it was $5 million per year over the next 5 years.
Thank you so much, Amber. So this was an interesting one because we didn't suggest a particular increase like we did in the other areas. We had overwhelming support, though. 90% of people asked for support for violence prevention and survivor support. And on average, people asked for $46 million for this type of support. It's amazing. You know, people are really starting to think outside of the box, outside of the policing box, looking past policing and incarceration and the ways that we have criminalized and our punitive excess and our propensity for that. I want to thank the speakers today. And, you know, for proposing, giving us a sense of what's possible, what's out there. And there are other things that are out there. There was a narrative portion of the survey that asked people, well, what else do you think we should be funding above and beyond these areas? And as you can see from the screen here, these are some of those responses. And, you know, as we get to the council meetings in the next coming weeks, we'll hear these and a lot more. I think we're in this moment, and I think people are really, they probably already knew about a lot of these things that will reduce harm, state sanctioned harm in particular. And we're going to hear this reimagination of what public safety can look like. And I so look forward to being part of this narrative change and this change in general, this transformation. And I want to thank you all for being here. I'm going to turn it over to Emily, who's going to surface some of the differences between the current budget proposal from the city and the WE Fund results. So Emily, on to you. Thanks.
All right, great. So can we have the next slide? And cool. So yeah, my name's Emily. I'm going to talk about the differences between what we saw in the WE Fund tool and what the proposed 2021 budget looks like. And I've got to say that it has just been so rewarding just pouring through the submissions and seeing what our community's budget priorities are. And then in the middle of that, Spencer Cronk released the 2021 proposed budget. And it's really just really nuts just looking and seeing how much that proposal does not line up to what people are asking for. And many of you may have read when this came out that the proposed 2021 budget that the city manager came out with divests $11.3 million from APD, with a 2.3% of that, with $2.3 million of that reallocated back to APD for a total of an $8 million cut. And that's actually pretty misleading, even though, so that in itself is just really inadequate given the community's outcry and the demands to defund and reinvest in other programs that help people instead of harm people. But yeah, the budget is actually much worse than that. The $11.3 million or the $8 million cut is actually just a cut to a previous plan to increase APD's budget. When you look at the proposed 2021 budget and just directly compare it to the 2020 budget, you see that it's actually only $150,000 of a decrease. And so that means it's only a 0.03% proposed cut, which again is just woefully inadequate when we see what people are actually demanding, especially because with the WE Fund APD budget, it was under 200,000. And here we have both last year's budget and the proposed budget for next year are 434 million. So really doesn't line up with the community's priorities at all. And what this means, if we can go to the next slide, is that because APD is keeping pretty much the exact same budget as last year, as far as actual dollars, there's not as much money for any of the priorities that y'all put in your survey results. So compared to what your submissions were through the WE Fund tool, the proposed 2021 budget gives $8 million less to Parks and Rec, $15 million less to EMS, $33 million less to public health, $7 million less to libraries, $34 million less to housing and community development. And actually, it's worse than that, because it seems like in the 2021 budget, they combined planning and zoning with neighborhood housing and community development to form a new department. And so when you first look at the 2021 budget, it looks like there's a big increase to housing, and that's actually not the case. Most of that comes from combining these two departments. So But when you look at the combination of those, the We Fund tool is still $33 million more for housing and services. And then, of course, the new budget does not have the Violence Prevention and Survivor Support Office. And so that's $47 million that isn't going to that program. So if we can go to the next slide. So obviously this is not what we want for our budget. This is not what our priorities are. And so if we can go to the next slide, yeah. So on Thursday, they're having a meeting on the budget in City Council. And it's really important for your voice to be heard at that meeting. We're going to submit the results of the We Fund tool. And again, we got amazing results. There were 1,600 submissions from y'all. But what they really need to hear is they need to hear directly from you. And so we're asking that you sign up to speak for the City Council meeting on Thursday. You can do so at this link. You need to sign up by noon on Wednesday. And if you want to get the full time to speak and not be cut down on your time, you should sign up to speak as soon as possible, but no later than noon on Wednesday. And we'll also have some other action items coming up, including a petition that we're working on around the budget. But really the best opportunity to have your voice heard is going to be to sign up to speak in City Council on Thursday. All right.
Yeah, thank you so much, Emily. And I don't know if there's any questions that have come in that we need to address, but I'll say before I, pass to others who might want to close here. Firstly, just thank you so much to all of the presenters today. Amber, Matt, Kate, Joy, Selena. We respect and acknowledge so much what you do in this community and also how it very much contributes to public safety and deserves the support and the funding that this community desires for it. And I think the defund has taken a lot of the oxygen, the energy in this work, and that there's a good reason for that. But what we're presented with right now in the next few weeks is not just an opportunity to dismantle, to reduce the power of and the presence of a force that causes a lot of harm in our communities. It's also an opportunity for us to actually advance and invest in those things that contribute to public health and safety in better ways, in meaningful ways, and that don't come with the risk of state violence and harm. And so it's an opportunity for us to reimagine how we make our community safe and to remake the morality of the budget that our city passes each year. So we encourage you very much to sign up. You have until noon on Wednesday to speak at this link here. You want to sign up for item 2. Now, just for many of you, you've spoken before, since they've gone remote through the COVID, signing up will likely mean a long day on the phone. Luckily, you can do other things, unlike sitting at City Hall all day. But you will have to sit on the phone and wait for your turn to be called. But we really encourage you to do that and have your voice heard. We've seen the debate move in ways, even though what they proposed is not near good enough. We couldn't get them to not increase the police budget last year. And then now we have real momentum to cut. And so that momentum is 100% because of folks calling in, not just during the council meeting, but also in between. So please do call the mayor, call your city councilman between now and Thursday. I hope you've been animated by some of these opportunities to fund and invest in public safety and health in other ways. Tell them you want to divest from police and invest in communities, and tell them how. Tell them you want harm reduction and homelessness addressed and violence prevention and all these other things. So with that, I will pass it on to my other co-presenters for any closing remarks. And again, just want to thank all the presenters for coming today.
Hey, Chris or Suki or Emily, there are a couple questions in the Q&A.
Yeah, so we had during the period of time that we analyzed, and of course there's still some people filling out the tool, and you still can, it's still up and available. But we had about 1,500 unique submissions from people within the city limits for the period that was analyzed for the results today. So I don't know what you mean by on the floor. I don't think it's going to be live and in person, the city council meeting. Sorry, there's a question about, is there a specific group of people who should be on the floor at the city council meeting? Unless somebody knows different, as far as I know, it's going to be remote as they have been. So it'll be conducted online, and speakers will have to call in. So you'll be remote as well. And so, yeah, hopefully what we've seen with this is that it's actually increased engagement, right? So we have more people signing up to speak than ever signed up when it was something where you had to come and be there. But it does mean a longer wait to sit on the phone because of the system that they use, honestly. There's definitely better systems for it. But yeah, so I think at this point, unless there's something else, someone knows different, I think it's going to be remote.
They offered some clarity to their question. They're saying, I'm just wondering, asking about voices, a group's voice. Is there a group that needs most represented? I think Austin needs most represented. We're all going to come in there with a different point of view. We will have these different areas from the tool, folks from these different areas representing, and we'll be speaking to that. But it doesn't matter, if you are, the more multidisciplinary, the more backgrounds we bring into that space, the more convincing we are. If we have teachers who are coming in and talking about violence prevention and making that make sense for their kids, like, what's that story? I think that's going to be really important to add that to this entire narrative, because they're not thinking along those lines. Or they may not be. So we invite everyone to come out, and if you filled out this budget tool and you selected to increase for a certain thing, then speak to that. Why did that speak to you? So that's all I'll say there. I mean, yes, we want all these different areas represented. They will be there, but you all come to.
Yeah, I think that's very right. I would also just add, there are definitely certain communities, there's certain classes of people that both the police and the people that want to continue to preserve the policing system that we have today often utilize, to my view, in a paternalistic way, as people that need protection. And that's why we can't do anything about police and change how we handle and address public safety in our communities. So I think if you belong to one of those communities, then it's important for you to have your voice heard within this conversation. And to say that's not how you perceive public safety, and that's not what you want out of your ideal community. So other questions: where can we see more analysis of GoFundMe data? So we are planning on releasing, I think, a more broad report here soon. So yes, coming soon will be a more detailed report. The council meeting starts at 10 on Thursday, is my understanding. And it will last as long as there's commentary. This is a meeting that's specifically around the budget, so there aren't any other topics that will be discussed. There is another meeting on the 30th where people can also speak to the budget, but they also can speak on other things. So for this meeting, it should start at 10, and it should be nothing but budget-related conversations the entire time. Will there be a warning for our time to speak? We should be listening and waiting. So when someone else remembers how they did this in the past, I believe that they just alert you when you're next. Is that what everyone else recalls?
So that's at least what it's been in the past. Sometimes they've made other changes before, like it used to be that you call in and now they call you. So it's possible they'll change it. But if it's done like it has been the last couple of times, unfortunately, you will just have to wait for your name to be called. They will give you a callback number, and you can call back in if you get disconnected. But then it seems that you go to the back of the line if you have to call back in. So yeah, unfortunately it is a wait and it's annoying. But yeah, if you get disconnected, you can call back.
All right, well, that's the last questions I'm seeing, unless there's some others. Yeah, there's a link there in the chat for the sign up. So again, want to thank everybody for attending the Zoom here, as well as those streaming online. Again, so much thanks to our presenters and co-presenters today. And again, thankful to everyone for joining us in this fight to really reimagine how we address public safety and really to think about how we can perceive safety outside of the threat of state violence, how we can really move towards communities that protect each other as much as possible. So, thank you.
Christy, do you want to answer this one last question that we just got? That was a really good sign off, so I hate to add on another question, but this one seems good for you.
Yeah, well, that one is special to me. Well, we'll see. So they turned in, this question is about Save Austin Now turning in their anti-homelessness petition today. So they have turned in their signatures. So at this point, my understanding is it's with the city clerk to validate the signatures and ensure that they have achieved the appropriate number in order to put it before the city council. If they get it to the city council in time, then the city council can decide to put it on the ballot in November. And at that point, there will definitely be a need for us all to be educating our friends and neighbors about what this petition really means and what it would really do. But for at least for 3 or so weeks, I think we're just going to need to sit and wait and see what happens with their signatures.
And just to add a little bit of context there, so this is a petition to criminalize homelessness in Austin and gives the police another excuse to be harassing people experiencing homelessness in Austin and give them tickets and put them in jail. Yeah, very pertinent to this conversation. So thank you.
All right, I do think that was the last question, and I will just say the final goodbye. I'll just jump in and say that. Wednesday, we hope that you all will call in and be engaged in this. I know it is kind of a pain in the neck, but that's, it's just one of those things, but I think it'll make a huge difference. Chaz, I see that you're unmuted. Did you want to say anything?
I just want to make sure it's Thursday. Let people know Thursday. Do not get on the phone and sit on the phone on Wednesday. But be sure to sign up Wednesday by noon for the council meeting on Thursday. And I just wanted to add it to Chris's point that I saw that the petition actually got 24,000 signatures. So now the city has 3 weeks to verify. So like Chris said, we just all have to stand by and be ready for the next part of this war. But yeah, it's a lot going on in the city. Yeah, but other than that, I'd say everybody, let's wave good night to these fine folks. Enjoy your evening, and Chris and Emily will be putting together this report, and we will get that out to you as soon as possible because I do not pay them, so we have to work on their timeline. All right, everybody. See you Thursday.
So.